If you're a Canadian senior, you may be paying more for medications, dental care, vision services, or other healthcare expenses than you need to. Every year, thousands of eligible seniors miss out on valuable government support simply because they don't know the programs exist or assume they don't qualify. In today's video, we'll walk through some of the most important healthcare and prescription assistance programs available across Canada, explain who may be eligible, and show you where to find official information. Hello, and welcome back to Canada Pension Pro, your trusted source for updates on pensions, retirement, and government benefits for Canadian seniors. Healthcare is one of the biggest concerns in retirement. While Canada's public healthcare system covers many essential medical services, it doesn't pay for everything. Prescription drugs, dental care, vision care, hearing aids, mobility devices, and home support services can still create significant expenses for retirees. The good news is that there are federal, provincial, and territorial programs designed to help. Understanding what's available could make a meaningful difference to your monthly budget and your overall quality of life. Today, we'll take a closer look at some of these programs, explain how they generally work, and discuss what you should keep an eye on as healthcare policies continue to evolve. One important thing to understand is that healthcare support for seniors in Canada is not provided through one single program. Instead, assistance comes from several different sources. Some benefits are available nationwide through the federal government, while many prescription drug programs, dental benefits, home care services, and medical equipment supports are administered by provinces and territories. Over the past few years, governments have also introduced or expanded several healthcare initiatives aimed at improving affordability, particularly for older adults and lower-income households. Depending on where you live and your financial situation, you may qualify for help with medication costs, dental care, vision care, or other health-related expenses. Because these programs can change over time, it's important to rely on official government information and review your eligibility regularly. Let's start with prescription drug coverage. Many people are surprised to learn that while hospital care and physician services are publicly funded, prescription drug coverage outside hospitals varies by province or territory. Most provinces offer prescription drug programs specifically for seniors. Eligibility often depends on factors such as your age, your province or territory of residence, your annual income, whether you're already receiving other government benefits. Some plans require a deductible before coverage begins, while others use co-payments or annual maximums. The details differ across Canada, so it's important to check the rules where you live rather than assuming they are the same everywhere. Next, let's talk about dental care. In recent years, the federal government has introduced the Canadian Dental Care Plan, which is being rolled out in phases. Eligibility depends on several factors, including age, household income, and whether you have access to private dental insurance. For many eligible seniors, this program may reduce out-of-pocket costs for preventive and routine dental services. However, coverage is not unlimited, and some treatments may require additional approval or involve cost sharing depending on your circumstances. Vision care is another area where support varies. Routine eye examinations may be covered for seniors in many provinces, but coverage for glasses or specialized lenses is often limited or income tested. If you're experiencing changes in your vision, it's worth checking what services your province covers before paying entirely out of pocket. Hearing care is equally important. Hearing aids can be expensive, but several provinces offer financial assistance or partial reimbursement for eligible residents. Veterans and certain other groups may also have access to additional support programs. Mobility aids and medical equipment are another area where assistance may be available. Items such as walkers, wheelchairs, hospital beds, oxygen equipment, and other medical devices may qualify for partial or full funding through provincial programs, depending on medical need and eligibility requirements. Many seniors also benefit from home and community care services. These services can include nursing visits, personal care, meal support, rehabilitation, and assistance that helps people remain safely in their own homes for longer. Access usually depends on an assessment by the local health authority or provincial care provider. 5. Real-life impact. Let's look at a practical example. Imagine Margaret, who is 74 and lives on a combination of CPP, OAS, and a modest workplace pension. She recently started taking 2 new prescription medications and worried that the additional monthly costs would strain her budget. After speaking with her provincial health office, she discovered she qualified for a senior prescription drug program that significantly reduced her medication expenses. She also learned she was eligible for assistance with routine dental care that she had been postponing because of the cost. In another example, David, age 79, began experiencing hearing difficulties. Instead of paying the full price for hearing aids, he found that his province offered financial assistance for eligible seniors, reducing his out-of-pocket expense. These examples show why it's worthwhile to review available programs even if you've been retired for many years. New programs may be introduced, eligibility rules can change, and your own financial circumstances may evolve over time. 6. Presenter commentary. In my view, one of the biggest challenges isn't necessarily the lack of programs. It's that many seniors simply aren't aware of what's available. Healthcare funding in Canada can be complex because responsibilities are shared between federal, provincial, and territorial governments. That means 2 retirees with similar incomes could have access to different benefits depending on where they live. It's also important to remember that announcements about new healthcare initiatives often take time to implement. A program may be announced before applications open, or eligibility may be introduced gradually over several months. That's why it's always a good idea to separate confirmed information from headlines or online rumors. 7. Practical advice. So what should you do next? Here are a few practical steps. Review the healthcare benefits available in your province or territory at least once a year. File your income tax return every year, even if your income is low. Many government benefits rely on tax information to determine eligibility. Keep your contact information up to date with government agencies if you receive federal benefits. Ask your pharmacist whether lower cost options or provincial drug programs may apply to your medications. If you have questions, contact your provincial health ministry, Service Canada, or your local seniors resource center for guidance. Also remember that healthcare policies continue to evolve. New programs, expanded eligibility, or revised funding arrangements may be announced in future federal budgets or provincial policy updates. Keeping informed can help ensure you don't miss opportunities that may reduce healthcare costs. Let's quickly review today's key points. Canada offers a variety of healthcare and prescription assistance programs for seniors, but eligibility and coverage vary depending on where you live. Support may be available for prescription medications, dental care, vision care, hearing aids, mobility equipment, and home care services. Many programs depend on age, income, residency, or other eligibility requirements, and some benefits are administered at the provincial level rather than federally. Most importantly, don't assume you're not eligible. Taking a few minutes to review official information each year could help you access benefits that make retirement more affordable. If you found today's video helpful, please give it a thumbs up and consider subscribing to Canada Pension Pro for reliable updates on CPP, OAS, GIS, retirement planning, healthcare benefits, and other government programs that matter to Canadian seniors. If you've used a healthcare or prescription assistance program that helped you, or if you have questions about benefits in your province, leave a comment below. Your experience may help other viewers who are navigating the same challenges. Thank you for watching, and we'll see you in the next video here on Canada Pension Pro.